Hey y'all, Dr. Daria here. The CDC just released a new report talking specifically about COVID in school-age children. I wanted to hop on because I wanted you to know not only what it says, but what it means. And I am an ER doctor, but I'm also a mom of 2 kids. So what does it mean for us us parents who are trying to look at the school year and what we should do to keep our children safe? So first, what it showed us. They looked at from March 1st to September 19th, and they said there were 277,000 laboratory confirmed tests in COVID cases in this age group during that period. About 37% were in children ages 5 to 11, 63% were in children ages 12 to 17. They also showed kind of a timeline. You can see here on this graph that the number of cases rose and peaked in July, then started to fall back down. That in July was when we had some peak across the country. They started to fall back down, and then it seems that they might be rising up. They said that the cases were rising in the last week that they collected data. So what are my key takeaways? Number 1 is remember during this time period, we really weren't testing kids. Those who got tested were those who probably really had symptoms of COVID or had a known exposure. So I think the number of cases in kids is probably higher. We'll know more as we start testing more broadly. Number 2 is a bit of reassurance, and that is that the mortality rate was low. So 1.2% of kids got hospitalized and just under 0.01% was the mortality rate. That's good, and that confirms what we've seen in prior data, which is that while children can get COVID and even can get severely ill, they are less likely to do so and they are less likely to die from it. Third point is that we cannot just dismiss COVID as something that only happens and only causes death in children who have comorbidities. Really important here, because this study showed that about 16% of all children hospitalized had at least one comorbidity. Of course, the data is not complete. Not all the children's charts had those filled out, but of those who did, 16% of those hospitalized had some comorbidity. Another paper that came out from the CDC in August, they said that 40% of children hospitalized had some comorbidity. Somewhere between 60 to 40%, we don't know exactly, but the key thing, it's not 100%. Nothing is even showing us near that number, which means that there is a significant amount of children who do get hospitalized who don't have a comorbidity. So again, all of us as parents, whether our children have comorbidities or not, we need to be aware of that, and we cannot just chalk it up and dismiss it if our children don't have a comorbidity. I just wanted to make sure we shared that. Big question and last takeaway is what happens next? The data showed here that while we had decreased in cases after that peak in July, it had started to rise again in September, notably in the last week that they collected data. Was that going to end up being a blip because of Labor Day, or is that going to be a trend that rises as school gets back into session, as temperatures get cooler and people get more indoors? We don't know yet. The only way we'll really know is as time goes on and we get more data. So I will be watching this. I just wanted to make sure you got that information, those key takeaways from this study. Now, question for you. Whether you're a parent or whether you're working with schools, what questions do you have? What experiences have you had with COVID so far? I'd love to hear it. Put it in the comment section, DM me, let me know. Of course, please share this with anybody else who would benefit from having this kind of information. Because you know why I'm here, to dig through all the spin to get down to the science, to give you the best information, to help protect you, help protect your family, and make your life healthier, better, and easier. Let me know what other information you need to have. I'm Dr. Daria. Stay well. Take care of yourself. Take care of each other. I'll talk to you next time.